Hello, my name's Elissa Thompson. This is my 10-minute talk and video on my poster, which is my interest, my research area, current evidence and care provision for patients presenting with autistic experience with a background of complex trauma, and this is a scoping review. Okay, so a little bit about me. I'm a nurse. I've been a nurse for around 7 years now. I've worked in psychiatric intensive care. I've worked on acute wards. Most recently, in the last 5 years, I've worked in the CMHT in Sheffield Health and Social Care. I work 2 days in the CMHT and 2.5 days in the Research Development Unit. I guess as my career's progressed, my interests in particular around patients or people with a diagnosis of BPD, borderline personality disorder, or EUPD, emotionally unstable personality disorder. For me, my interests lie in sort of how services are structured, how services support people with these diagnoses. I do think that there's a lot of a good practice, and there's been a lot of advancements in throughout my nursing career, which is really brilliant. But I do also think that there's some areas that do need sort of a little bit more attention, and some areas that are lacking in services. And I think one in particular area is people with these diagnoses and with an autistic experience. So just a little bit about language. In this piece of work, I've had some discussions with people who use services, and I've tried to be mindful of being a little bit less clinical. I am a clinician, and it's difficult for me to sometimes to move away from these labels, but I think the terms autistic experience and complex trauma, background of complex trauma, are a little bit better at capturing kind of the understandings that I'm wanting to go for people with these experiences, with these diagnoses. So this is the language that I'm aiming to use in this piece of work moving forwards. Okay. So this piece of work, I thought let's have a look at the research then. What is the research around people who experience these two things? What are the clinical guidelines? As a frontline CMHD staff member, I'm not aware of any clinical guidelines that are provided or that have been made known to me. So I did a scoping review on these two things. I feel in terms of my clinical experiences, that there's a lot of stigma. There's a lot of inflexibility in services. I think there's very much a one-size-fits-all approach to people with complex trauma, and a lot of the time, at the worst, we may exacerbate people's experiences and make people's symptoms worse. And this is really, a difficult area, really important area that we need to think about. Most recently, there was quite a high-profile case of Zoe Zaremba under the care of Tyne and Weir Trust, and she very sadly lost her life this year. And after her death, her family spoke out and felt that her diagnosis of autism, she was actually diagnosed with borderline personality disorder and treated as such, and they felt that this was a misdiagnosis and that her care was not appropriate for her, which led to her situation deteriorating. So yeah, very sad, and definitely an area that we need to be thinking more about. So moving forwards, my review, I was looking at language, and the diagnostic language around autism on one hand, and the EUPD, BPD, complex trauma on the other hand. So these were my inclusion and exclusion criteria, just to kind of get an idea of what's kind of out there really. So in my review, I included 29 studies. In full text, 6 were excluded, as I did not feel that they met the inclusion and exclusion criteria. There was quite a lot of research around people with autism and PTSD, and I was sort of focusing on the complex PTSD kind of diagnostic area and the complex trauma. Okay, so my findings were generally confirmed my clinical experiences really, that autism is mostly quite on the what we might call a subclinical end. So if you think about an autistic spectrum, this are people who are quite high functioning, quite sort of managing, or seem to be managing well in society, not particularly disabled by their autistic experience, and sort of navigating services. and that this was not diagnosed and not acknowledged at all, and often diagnosed, or maybe just diagnosed, as borderline personality disorder or EUPD. The research suggests, the evidence suggests that there is an overlap between people with autistic experience and complex trauma, and people who have experienced this overlap actually have more higher risk, more complexity, and require more individualised care. Okay, there wasn't a lot of guidelines at all around this area. There was some guidelines released by Cambridgeshire in 2015 that were looking at the local social context and constructs in terms of the service provision in that area, which was good. It's quite old and very localised. There was a really good guidelines that were written by Mind, so written by people who use services, people with autism and comorbid, again trying to move away from the clinical language here, and mental health problems, and that including BPD. So the foreword was written by a lady with diagnosed with BPD, and then a really good review this year by Gordon et al, doing something quite similar to what I wanted to do here, a review of the research and the evidence and some clinical guidelines on the back of that. So okay, so that's what I found. Moving on, so what did this mean? What did this mean to me? Again, going back to language, there was a heavy diagnostic and clinical language, which I found potentially is going to be quite pathologising, stigmatising. For example, those with autistic experience, perhaps being labelled or their behaviours being viewed through a BPD type lens that may be overlaid with some stigma, some value judgments there, and that's that people with autism or autistic experience, that the research suggests that they may behave in certain ways, but there's different reasons behind that. There's different sort of motives, different emotional experiences to people who don't have autistic experience, and it's very complex, and an individualized care, again a one size fits all PD kind of pathway, maybe not appropriate for people in that situation. Again, there was quite a lot of research and there was discussion around people with autism are more likely to have a history of trauma. They're more likely to be targets of abuse, bullying, and that was really important, and some suggestion that people may be more vulnerable to mental health problems. They may have a deficiency in a way, and my argument would be that there's a difference rather than a deficiency in people's ability to cope, for example, when they're sort of navigating through adolescence in a society that doesn't really sort of understands them, perhaps sort of responsive to their needs, can be traumatic in itself. People then have mental health problems. They then approach services, again, which are not geared or understanding of their particular need, could then sort of, even be seen as a re-traumatisation, and a really sort of quite a negative experience for people in this category. And having to sort of navigate and survive inappropriately sort of structured services could be catastrophic, really, and something I've probably seen a little bit in my clinical practice as well. So thinking forwards in terms of sort of like future research and where would we go from here? So I think guidelines, there needs to be more guidelines for frontline clinical staff. The paper by Gordon et al. Suggested formulation work and individualised care is really important for people in this category who have both these experiences, and that's great. I think more sort of research moving forwards needs to be co-produced. So thinking about language, thinking about the power and the action of language for people who use services, people's experiences as users of services should be incorporated in thinking about how to better support people, rather than sort of sticking to sort of clinical ways of thinking and diagnostic ways of thinking. There should be a lot more flexibility. In my experience, people who present with autistic experience and complex trauma, no people are the same, everyone's different, and these care plans should be really sort of considered and individualised, for example. Okay, so overall I think this is a key area in research and development. However, co-production and formulating challenges people face in identifying helpful strategies and understanding what is needed is largely missing, really. And what I found is sort of the research gap. I think research could coordinate more joined up understandings between people who use services and clinicians working in services, to sort of cover that bridge, really, between service user and professional perspectives. Okay, so thank you very much for listening. That was my 10-minute talk, and my poster will be available as well, I believe. Okay, thank you very much.